Hello, I'm Dr. Deborah Brooks for the Joint Telepsychiatry Toolkit for the American Psychiatric Association and the American Academy of Child and Adolescent Psychiatry. I'll be discussing the use of telepsychiatry in the juvenile justice system. Youth in the juvenile justice system are historically tremendously underserved in terms of psychiatric care. In addition to the general nationwide shortage of child and adolescent psychiatrists, youth in juvenile justice face even more barriers to care. Many of the juvenile detention facilities are in rural areas where there are few, if any, child psychiatrists, and some doctors don't feel comfortable dealing with such a complex population. Yet these youth have demonstrably higher rates of psychiatric disorders that have likely contributed to their current placement. Here's where telepsychiatry comes in. Telepsychiatry is an effective tool for working with youth in the juvenile justice system. Here at University of Maryland, we have been working with DJS for 3 years to provide telepsychiatry services to youth at several different facilities. We are most proud that we have reduced the time to intake with a psychiatrist from 6 weeks with an in-person psychiatrist to 6 days with a telepsychiatrist. We have also implemented electronic medical records that allow seamless integration when the youth are transferred from site to site, as they so often are. As with all medical care, evaluating and caring for youth in DJS has its challenges and its rewards. Oftentimes, as a result of being in their current situation, adjudicated youth may have a dislike and mistrust for authority figures, which, as a doctor, you are. As with many teenagers, the youth may not want to talk to a doctor at baseline, and they're often pulled from a desirable activity, such as gym or music, to attend appointments, which already starts the relationship on rocky footing. While many teens are comfortable using technology, they may not have used it for medical purposes, and they can be skeptical of its utility. Privacy concerns also arise, as security officers may escort youth in some facilities to their appointments. Rarely is it just the doctor and patient witnessing the conversation, and youth may be concerned about staff learning information about them. If you as a doctor find yourself in this situation, you may have to perform a truncated evaluation, focusing on just the critical aspects, such as safety. Forcing information out of a tight-lipped and usually already oppositional teenager will only damage rapport and may prevent the youth from returning for another session. Just as there are challenges, there are many benefits to working with the DJS population. The on-site therapist is generally greatly involved in the youth's care and can provide a plethora of information about the youth's behavior between sessions and their medication compliance. In addition, youth in DJS custody come with a good bit of paperwork. But before you groan about extra paperwork, DJS youth often already come with psychosocial evaluations, psychological testing, medical histories, educational reports, and anything you can imagine. Basically, these youth already come with all the information that you might spend months as an outpatient psychiatrist collecting. And as newfangled as telepsychiatry is, a lot of the inter-session communication with the DJS facility, including the sending of these documents, is done through ye olde fax machine. Having all of this background information actually helps build rapport with the DJS youth. Issues read about in documentation can be brought up directly, avoiding the opportunity for prevarication on the patient's part. Also, small details about telepsychiatry can be huge gateways into these kids' lives. For example, in some facilities, there are no mirrors, so youth will sometimes come to the sessions with me just to see their reflection in the picture-in-picture feature and do their hair. Sometimes, all it takes is a little in to get the youth to crack a smile and open up, even just a little. Another benefit to telepsychiatry for the physician is the creativity it allows. DJS youth are encouraged to come to appointments and to take their medications, but they're not forced to. And for these youth, refusing their medications or appointments may be the only control they can exert. Working with the youth, being creative, and using negotiation skills is vital to ensure compliance. Another word on medications. You, the psychiatrist, must be familiar with the medication consent laws applicable to the state your patient is in. For example, in Maryland, the parent or guardian and the youth must consent to medications if the youth is under 16. But if the youth is older than 16, you just need the youth's consent. I personally have never felt unsafe with this population, but I know that safety concerns do arise. Seeing these youth through tele eliminates that concern for personal safety and allows the doctor to stay cool and collected, and at a safe distance miles away, should a crisis develop. Hopefully that distance and minimal personal safety concerns could potentially open up the care of this population to a wider range of child psychiatrists. I hope this brief video has opened your eyes to the possibilities of caring for youth in juvenile justice through telepsychiatry. I'm Dr. Deborah Brooks for the Telepsychiatry Toolkit, and thank you for watching.